All right, I want to welcome everyone joining us for the Sustainable Energy Seminar here, our first of the spring 2025 semester. This is your first time joining us for one of our Sustainable Energy Seminars. My name is Scott Williams. I'm the Education Manager here at the Wisconsin Energy Institute and the organizer of this seminar series. The Sustainable Energy Seminar is held every other week in the fall and the spring, and our goal is to highlight the cutting-edge research from across UW-Madison and beyond, and to showcase how different disciplines understand energy challenges and develop solutions. Throughout the series, we hear from experts in science and engineering, as well as social sciences and humanities, to get a fuller picture and learn about the ways in which they view sustainable energy challenges and solutions. The seminar is open to the public and is also a course for students in the undergraduate Engineering for Energy Sustainability certificate, as well as the master's program in Sustainable Systems Engineering. So starting this semester, you'll notice we are no longer doing a hybrid format. We're offering this seminar online only through Zoom webinar. And your registration for this webinar gives you access to all seven webinars coming up this semester. We do have live captioning available for those who would like to use that feature. Just click on the Show Captions button at the bottom of the Zoom screen. And if you have a question for our presenter, please use the Q&A, which is also a button in Zoom, and I'll be monitoring those. And Jonathan, do you prefer to wait for questions to the end, or are you okay if there's a decent stopping point to interrupt?
Mostly at the end, but unless there's an important clarifying point, I can take a question, but we can wait till the end.
All right, sounds good. So with that, I'll introduce our speaker for today. Jonathan Patz is the Vilas Distinguished Achievement Professor and the John P. Holton Endowed Chair of Health and the Environment here at UW-Madison. And from 2011 to 2022, he served as the inaugural director of UW-Madison's Global Health Institute. And he has faculty appointments in the Nelson Institute for Environmental Studies, as well as the Department of Population Health Sciences. Professor Patz also directs the university's Planetary Health Scholars Program. In 2019, he was elected to the National Academy of Medicine for his pioneering work at the intersection of climate change and public health. And his efforts in this realm date back to 1994, when he convened the first ever session on climate change for the American Public Health Association. So for nearly 30 years, Professor Patz has taught and conducted research on climate change and has published over 200 science publications and several textbooks on this environmental public health topic. He leads the Climate Solutions for Health Lab here on campus and was recently awarded a grant from the National Institutes of Health to lead the new Health First Climate Action Research Center, which I'm sure we'll hear a little bit about, and in general, the topic of health benefits from the low carbon energy transition. So welcome, Jonathan.
Great. Well, Scott, thank you for that nice introduction and for letting me talk about my passionate topic, which is the health benefits from decarbonizing our economy. And so I'm going to be diving right in. But before I give you the good news, of course, we have, this news facing us right now. Wildfires are occurring still around Los Angeles. This is the news from last week. And according to some scientists at UCLA, they looked at climate change as a factor in these LA fires and found that climate change may be linked to roughly a quarter of the extreme fuel moisture deficit when the fires began. And, this is looking at 150 years of data, looking at how dry was it from last May up until this January. That period last year was the second driest in the last 150 years. And that period was also the third warmest. And the Santa Ana winds are not quite off the charts, but pretty high speeds. So you could have a recipe for disaster there. But the big question is, what's climate change got to do with it? And this is a study from the Proceedings of the National Academy of Sciences showing that human-induced climate change is responsible for over half of the observed increase in Western forest fuel aridity and double the forest fire area burned over those periods, those years. So there's evidence now that climate is having an impact on these fires. Now, if any of you remember the summer of 2021, when it was blazing hot across the Northwest US and Western Canada, and these fires led to tremendous smoke plumes that affected us across the country. I remember an orange sun around then in Wisconsin. That event was so extreme that, according to well, hang on, before I get there, let's talk about the health effects of the smoke. You know, it's dangerous to children especially, and this is showing that wildfire smoke may be 10 times more harmful to very young children with the chemical makeup of the fine particulate pollution from wildfires. And this event was documented statistically from the World Weather Attribution Initiative, showing that today's warming from anthropogenic greenhouse gas emissions, leading the world to be 1 degree centigrade warmer, increased the likelihood of that event by 150-fold. In other words, it was virtually impossible without climate change. And if you remember, farm workers died during that summer. There were reports of vinyl siding melting off of buildings. The town of Linton, British Columbia, got to 121 degrees Fahrenheit and then ignited. So this is where climate scientists weren't able before to attribute to climate change, but now with this Weather Attribution Initiative, we're able to take a look at that. So think twice the next time you hear about a climate disaster referred to as an act of God, because we're the ones causing this. Then in summer of 2023, New York was the most polluted city in the world because of the fires up in Quebec. According to the World Weather Attribution Initiative, climate change made those fires twice as likely to have happened. So who's affected? What is it around the world? What is the risk, the public health risk from wildfire smoke? This is a cover of Nature paper, and we're now collaborating with this team from Australia as we move forward and look at North American effects. But globally, the effects of wildfire smoke and also short-term urban air pollution effects is killing about 1 million people a year. This is looking at 20 years of data from short-term PM 2.5 exposure. And so significant health impacts. There are other impacts from wildfire smoke now being documented, especially for pregnant mothers, because we're seeing preterm birth and low birth weight outcomes from wildfire exposure. This is a study in Australia where they have lots of bushfires. So, you know, there are broad impacts here that we're concerned about. Now, I gave a lecture, this similar lecture last week when it was snowing in New Orleans and freezing cold. So just a reminder, when we're talking about heat and global warming, you know, our very own Steve Vavris was part of the discovery of the polar vortex. And as most of you already know, the Arctic is warming twice as fast as any other place in the world. And as the Arctic disintegrates, those polar vortex winds are disrupted and slow down. So you get this steeper deviation of these polar extremes. So we're going to see more of that, you know, as the Arctic disintegrates. So, you know, sorry for the rapid fire introduction, but I want to give you 3 general narratives for climate change. It really is serious. It's a human health crisis. There's so many ways that climate affects our health. There are equity challenges. Some populations more impacted than others, and certainly an intergenerational injustice, thinking about the next generations. But the larger the crisis, the greater the opportunity. And this lecture really focuses in on why we should think about addressing climate change with enormous opportunity, and what will come from decarbonizing our economy could be unbelievably awesome, especially through a public health lens. So, we know that burning fossil fuels and cutting the carbon sinks, cutting the rainforests, increases these greenhouse gases that cause climate change, which is rising temperatures, sea level rise, hydrologic extremes, more droughts, floods, and as we see, wildfires. And there are all these different pathways through which climate affects our health, be it the direct heat effects, respiratory disorders, infectious diseases, food insecurity, and mental health impacts, and even violence. So knowing that, where can we intervene? Well, we can sort of intervene here. And so I just want to check with you, Scott. Are you able to see my pointer?
Yes, it's a fairly small cursor, but I can see it.
Okay. All right, good. Okay. So we can intervene here and reduce the exposures and build up resilience. But I call that secondary prevention. Wouldn't it be nice to go upstream and stop, at the problem, stop the problem, which is burning fossil fuels? And as someone has once said, we have to think about not just mopping up the mess on the floor, we need to be thinking about turning off the faucet. So we need primary intervention here and the secondary intervention there. So we need, to build resilience and adaptation, sustainable built environments, and we need to think about policies like the energy policy and energy analysis and policy program that teaches us about energy policy. And I recognize these policies are human health policies when you look at this diagram, because our health depends on clean air, depends on physical fitness and transportation that allows for active travel. Certainly sustainable plant-forward diets are healthier, and they're also less polluting. So really important to be thinking about primary prevention as well as secondary prevention. And we need to be looking at all ways to intervene, and so build the public understanding of climate change, build movements so that we can really get all these policies in play. This is the how I've set up our second edition textbook, which, by the way, all of you have free access online, because our library, Ebling Library, has a subscription. So everyone listening can have for free this entire textbook online. But this talk is about the positive messaging, why climate action is a golden opportunity. But I just have to give you a few more negatives. Sorry, just to let you know that it really is a serious problem, and the climate attributes, warming, extreme precipitation, floods, drought, storms, affect us through all these different pathways. And this systematic review of climatic extreme impacts on health found more than 1,000 pathways through which climate affects our health. As far as the equity story, we know the terrible story about red line neighborhoods. If you were Black, no matter how much money you had to buy a house in these red lined areas, which were very not nice neighborhoods. And then later investments for parks and trees went elsewhere. And you can see all the green space here. Well, if you look at the satellite image on the right, this is the urban heat island effect over the city of Richmond. You can see these red-lined neighborhoods have the biggest urban heat islands. So it's not fair that poor communities that were forced to settle in these red-lined areas are also experiencing the worst heat in cities. Same with extreme flooding. When you look at this situation that's becoming more repetitive as climate is making the 100-year flood turn into the 20-year flood or the 10-year flood, unfortunately, a race has passed, a flooded future. The formerly red-lined areas are at much higher risk of this type of situation. And then finally, thinking about, what do we have to do about this? After the 2015 Climate Summit, world leaders asked the IPCC, what would it take to stabilize the Earth's climate below 2.5 degrees centigrade, above which would be disaster? Can we have a little safety in there? What would it take to stabilize at 1.5 degrees centigrade warming above pre-industrial levels? And the stark news, of course, is that it would take 45% reduction in greenhouse gas emission by the end of this decade. So in 5 years, we have to cut emissions almost by half. So that's pretty, that's an emergency. And it also points out that, as these things are happening, we cannot adapt our way out of the crisis. We really need to look upstream. This is, the climate scientist and evangelical Christian, Dr. Catherine Hayhoe, making this statement. But, as hard as it may seem, as far as going upstream and decarbonizing our economy, from the public health point of view, there are incredible benefits to be had. So for the last 10 years, I've been talking about challenges and opportunities regarding climate change, and that solving the climate crisis could be the greatest health opportunity of our times. A low carbon future could improve health and achieve economic benefits, and climate solutions double as health interventions. A paper we did with Project Drawdown recently. So the larger the crisis, the greater the opportunity. And it's why I've rebranded my lab to focus on the positive solutions here. When I went on sabbatical, stepped down from directing the Global Health Institute and went on sabbatical, I came back and rebranded our lab. We're called the Climate Solutions for Health Lab in the Center for Sustainability in the Global Environment. And you should know that the National Academy of Medicine really prioritizes climate change. They often don't announce a grand challenge, but now they have a grand challenge on climate change, human health and equity. There's one part of it, an action collaborative to decarbonize the health sector. The US health sector emits 8.5% of the national emissions. On average, health sector emits 5% of national emissions, but the US is pretty intense as far as our healthcare sector being consuming a lot of fossil fuels. But the other component of the National Academy of Medicine is a cross-sector roadmap for transformative action to achieve health and equity at net zero emissions. And so this is an activity over the next 2 years to bring experts together across all sectors where we can optimize both the emissions reductions for climate that have big health benefits and some obvious ones. I'll show you some obvious ones in just a second. Morgan Edwards and I are working with the London School of Hygiene and Tropical Medicine They lead this Pathfinder initiative funded by the Wellcome Trust. And they're looking across sectors, including agriculture, forestry, and other land use, and energy generation, electricity generation, industry, buildings, transportation. You look at all those different sectors, and you've got big influences on air quality, on diet and physical fitness, physical activity, that have enormous health benefits across all these big areas. And so this is where we're beginning to quantify the health benefit of decarbonizing across all sectors. Just looking at 3 sectors, looking at energy, air pollution kills 8 million people every year. And of those 8 million people, 5.1 million premature deaths come from burning fossil fuels directly. So that is an enormous benefit if we can get away from dirty power generation and get to improved air quality and save a lot of lives. The food sector, our Western diet with a high red meat portion is not sustainable, and it's also unhealthy. Eating red meat and cholesterol causes heart attacks and strokes. And if the world were to adopt a healthy reference diet, which is a plant-forward diet, very little red meat, and it's similar to the Mediterranean diet, that could avoid 11 million premature deaths every year. And the transportation sector, thinking about our over-reliance on private motorized vehicles leading to sedentary lifestyles, well, the amount of biking and walking today that exists is already saving 4 million lives every year. So if you add up these millions, we're talking about 1/3 of all premature deaths every year. Not trivial. This is that article that came out from the British Medical Journal last year, well, actually fall of 2023, showing that 61% or 5.1 million deaths are directly linked to burning fossil fuels. And even though in America we have the Clean Air Act, we still have people that die from air pollution. You can see, especially in the Ohio River Valley, where we still have coal-fired power plants, we still have a problem. Over 100,000 people die in the United States, and we have some of the best air quality regulations. We are much cleaner than other countries, but it's still an issue. So getting away from dirty electricity generation is really important. The National Academy of Sciences in the fall of 2023 looked for ways to decarbonize across the United States, and noticed that there's a chapter on public health co-benefits when you think about the multiple ways to decarbonize and how many of those will have an immediate benefit for public health. Not just reducing the risk of climate change, but immediate benefits where, improved air quality, sustainable diets, and more health-promoting transportation will have benefits. I don't know how many of you know Nick Mayu, who just defended his PhD last month, and one of Tracy Holloway's former students, David Abel, and of course Tracy and me. We, led by Nick, we looked at decarbonizing across sectors in the US, and the headline is that more than 50,000 lives would be saved every year, over $600 billion in avoided deaths and hospital costs. So these are impressive numbers, and it just shows how positive getting away from fossil fuels can be to our health. And this is from Nick's study showing the darker the blue, the more the benefit. Certainly, this looks like electric power generation. This is probably a lot of vehicle cars. Around here would be petrochemical industry. So, positive benefits. And I have seen false narratives going around. Well, actually, I'm going to get to that in just a second. So anyway, benefits from decarbonizing. So Tracy Holloway and Greg Nemeth, they published, I think in 2011 or 2010 about decarbonizing and the health benefits. And then Jason West updated their national study to go international. So Tracy, Greg, and Jason looking here at, okay, what would it cost to avoid emitting 1 ton of CO2? It might cost up to $30. Yeah, but when you don't burn coal and oil and you don't emit that greenhouse gas, you're also not emitting the dangerous fine particulate pollution and other harmful pollution elements, so that for every ton of CO2 avoided, you have a big health benefit from improved air quality. So which number is bigger? And policymakers have only been looking at this number when this is the bigger piece of the story. And they admitted they were only looking at this when I know state legislators were saying, yeah, we hadn't thought about these benefits on the tail end, but that's the far larger piece of this equation. But according to Greg Nemeth and others, this number is probably wrong. It probably doesn't cost $30 to avoid a ton of CO2, especially when you look at the price of solar energy just plummeting in the last 40 years. And Greg Nemeth has a book, Why Solar Got So Cheap. And the International Renewable Energy Agency, in their 2019 report, talks about renewables being the cheapest way to generate electricity if you were to eliminate all government subsidies. And I do remember a La Follette Energy Forum that I participated in, and the speaker following me introduced himself as a conservative Republican for renewables, because as a conservative, he does not believe in government subsidies. And he said, if you go with the free market, there's no argument anymore. We should be investing in renewable energy. Just quickly to touch on the food sector. This is the go-to Lancet Commission report on sustainable food systems, led by an eminent food diet epidemiologist, Dr. Walter Willett from the Harvard. And I'll just show one diagram from that report showing that if the world adopted the healthy reference, the universal healthy reference diet, which is a diet over here that we know about, more fruits and vegetables, unsaturated oils, a little bit of seafood and poultry, hardly no red meat or processed meat, starchy vegetables. So we should not be eating anything to the right of this dotted line. If we were to do that, that would save 11 million lives every year. And knowing how much land degradation and deforestation goes into livestock, Tracy, Holly Gibbs is an expert on this, looking at deforestation in the Amazon for livestock, how much water, fossil fuels, diesel, growing food crops to feed livestock, just tremendous environmental footprint. So save lots of lives, protect the environment if we can get to this universal healthy reference diet and get away from a meat-based diet. It doesn't say you have to be vegan, but just we need to eat a lot less meat. Finally, the transportation sector. Cities in the United States that have the highest levels of walking and cycling to work have lower rates of obesity and diabetes compared to cities that don't do well in this regard. But keep in mind that that exercise is really beneficial for all sorts of diseases, to reduce disease risk from heart disease, cancer, dementia, and depression, because contracting muscles are chemical factories for anti-cancer and cardiovascular diseases. And chemical factories for these chemicals that prevent those diseases. Exercise also boosts the immune system. So it's really impressive how exercise is beneficial beyond just burning calories. And in our group, we have Dr. Sam Yonkin is working on the health-oriented transportation model, HOT, a HOT model. If you look at the United States, average bicycle commuting is less than 1%. Madison is 6%. And if the US was similar to Madison's bicycle commuting, that would save 20,000 lives a year. If we had 20% bike commuting, like at UC Davis, that would save about 50,000, 45,000 lives every year. So, doesn't it beg the question that isn't it time that we design cities for people instead of for cars? And, we're talking about safe biking, not just everyone jump on a bike and go out there, because it's got to be done safely. So we need to design cities that are fair and, allow for alternative transportation. While there's a lot of talk about the electric car, already e-bikes are having a great effect at slashing demand for oil. So, here in Madison, we're lucky. We're in a platinum ranked city for bikeability, but there are so many other cities that don't have that opportunity like we do. And finally, I want to just say that, more than just designing cities for people for transportation, thinking about green space. This is a study out of the proceedings of the National Academy of Sciences that looked at green space impacts on mental health and showed that no matter where you grew up, this is the country of Denmark, no matter if you grew up in a small rural city, a rural town, provincial city, a suburb of the capital, even in the capital, that your risk of developing a psychiatric disorder during your lifetime was inversely related to the amount of green space. This is a satellite-derived green space, normalized difference vegetative index. So green space protects and really offers health benefits that are important, mental health benefits. But thinking of design is not by accident. This is Copenhagen in Denmark, and the image comes from the 1960s. This is today. That same image, those same buildings back in the 60s and now today. So vision and intentional design is really essential. So, and these things don't happen by accident. So we really need to think about our design. And this obviously is a walking mall. I got rid of the cars. This is healthy, physically healthy, mentally healthy, and probably financially healthy, because this is absolutely going to be a destination for commerce. So before I open this up for questions, just a final note on communicating health and climate. We need to pay as much attention to the how to communicate as to the what we should be communicating. I don't know how many of you remember in the middle of the COVID pandemic, the World Health Organization, they said that they feared the infodemic as much as the pandemic. And in our era of social media, cable news, and innumerable so-called experts polarizing the climate discourse, effective persuasive communication is key. And this is an acronym from Professor John Cook at Melbourne University. And he's got a great website called skepticalscience.com. And if you guys can remember this acronym, FLICC, FLIC, all disinformation messaging has one or more of these techniques of deception. It's either the information is coming from fake experts, making logical fallacies, having impossible expectations, cherry picking the data, or conspiracy theories. So disinformation they'll use one of these or more of these techniques. And for those of you that, are trying to communicate better, of course, the person in front of you that might be disagreeing, you don't want to insult them and you don't want to call anyone stupid ever. But you want to ask them, where's their resource? Where are they getting this information? And attack the source of information. We need to call out the fake experts, the logical fallacies, impossible expectations, cherry picking, and conspiracy theories. It's really important to call that out. And according to Ed Maybach, who is a communication scientist, we need simple messages repeated often by trusted messengers. And he sums up this whole issue in 10 words. Climate change, it's real, it's us, it's human induced with the fossil fuel burning. Experts agree, and that's, real climate scientists working on climate change. 99% of them agree. There are plenty of scientists out there, but they might not be climate scientists, and then there are plenty of non-scientists that are posing as scientists, but the experts that are working on this are in pretty much full agreement. Unfortunately, the second rule of journalism is show both sides. So, in an article, you'll read about the 99% agree, you read that climate change is real, but then that 1% of disagreeing climate scientists will get equal time in the news article. And that's not right. And that's why the public gets confused. So these are things that you should point out. So it's real, it's us, experts agree. It's bad news. It's, all the impacts of climate change, but there's hope. And if you don't deliver the message of hope, then you will paralyze people and they'll just say, what's the point? But I sincerely believe and show the evidence behind why there should be reason for hope, especially if you take the public health angle. And I know not many of you are in the health field, but if you know people in the health field, or if you are in the health field, we need trusted messengers, and nurses and doctors are super trusted. So that's important to, be delivering messages with trusted messengers, but also knowing your audience. And this is the 6 Americas survey on Americans' attitudes on climate change. This is from 2014. This is from 2022. And recognize that 2/3 of Americans are concerned or alarmed about climate change. So when the squeaky wheel gets the grease and you hear, climate deniers, this is the dismissive group over here, just, saying there's no, this is all nonsense, don't believe it. Don't be timid, and say, well, I'm worried I might say something wrong or I might offend somebody, when you should recognize that 2/3 of the American public really is concerned about climate change. And Catherine Hayhoe, she says, so just talk about it. Talk about climate change as much as you can, not to think that you are, you guys who are studying this, that you're in the minority. You're in the majority. Most people want to know about this and they're concerned about it. So be active, but also understand that we are in this sea of disinformation. And I would ask you to use John Cook's FLIC acronym and be calling out the sources of disinformation. So with that, I just want to conclude and save time for questions. The health benefits narrative is beginning to reach decision makers, but communications are needed, showing why solving climate change is a golden opportunity for health. We need to get out there and deliver that message much more. And with that, from the Climate Solutions for Health Lab, I thank you for your attention. There's our website there, and I will open this up for questions. I'll stop sharing my screen. Over to you, Scott.
Great. Thanks, Jonathan. Yeah, so please submit your questions in the Q&A. I can read them off. And so we do have a question here from David in the chat. Could you briefly explain what PM 2.5 is, and does the WHO have a recommended safe level we should be striving for with particulate matter emissions we can control?
Yeah, so PM 2.5 are particles that are 2.5 microns in diameter, which I think is about 10 times smaller than the diameter of a hair follicle, which I hardly have any left. But tiny particles that go deep into the lungs, and that's why they're so damaging. They are in the air pollution epidemiology, they are about the worst. As far as what we have evidence are, as far as they're one of the worst things to breathe in. Diesel has a lot of fine particles like that. Diesel is really bad. And they've lowered the WHO standard. Somebody correct, you can Google that. It used to be 10, I think, 10 micrograms per cubic meter. Someone can Google that faster than I can do it, but it's gone down. It's very low. Someone in the chat, find out what is the current WHO standard for PM, and EPA has also dropped its standard as well.
Thanks. And had some links shared by Sandy in the Q&A. I've just copied and pasted those in the chat if anyone's interested, including the link to that FLIC, those 5 techniques, and then some other work on healthcare and life cycle assessment.
Super.
And then, so we have a question from an anonymous attendee. What and how to do in the specific reality of drill baby drill present and near future U.S. withdrawal from Paris Agreement, WHO, Green New Deal, etc.
So, a couple things. So number one, none of this is a surprise. We knew that the new administration would pull out of the Paris Agreement. They did that the first time. My sense of this is that there is more common ground around health. Everybody cares about their health, the health of their children, the health of their grandchildren. So to be honest with you, with the current shift in administration, I think this health messaging is going to be that much more important. That when we talk about climate change, it is about health. And, certainly there's already, all sorts of going backwards on a lot of things, but there are things that are not necessarily going to go, the new administration, when they talk about drill, baby, drill, oil companies don't like that because the price of gasoline is pretty cheap right now. And oil companies don't want a glut of oil and ruining their profit margin. So That's one issue. I know that he's saying we want to go backwards on electric vehicles. Well, half of vehicles sold in China are electric. The global economy is shifting to electric vehicles. So the automobile industry really doesn't like this because they're saying, well, okay, well, we can sell more gasoline cars, but in a few years when we have a new administration, the rest of the world will have advanced so far ahead of us. If we don't have any technology to move forward with electric vehicles, we're going to be dead on arrival. Our industry is over. So, he's getting pushback from industry because it's just not economically strategic. So, we are having whiplash, and he's, flooding the zone and all this stuff. But there are going to be lots of issues around these areas that are not going to go through. Also, states attorneys general are lining up, so there'll be lots of lawsuits against some of these things. But it is disheartening for leadership at the top to go backwards on the advances we've had in getting to a low carbon economy, which is better for our health. But I don't think all these things are going to get through. And also it's a time to pivot locally. In this region, we have 4 governors, Democratic leaning state Supreme Courts and attorney generals that I think it's a great time to advance as fast as possible at the local regional level.
Okay, thanks. And thanks to Lizzie, who posted in the chat that the WHO guidelines is 5 micrograms per meter cubed and the EPA standard is 9 micrograms per meter cubed. And then a related question from Mary regarding the danger of particulate matter, especially for young children. Is this something that may cause longer term damage, or is it something they can recover relatively quickly?
Right. I don't know. I'm not that expert. So I'll just tell you that certainly air pollution exacerbates asthma, and that can be multiple years. Children often, as their airways get bigger, they can grow out of childhood asthma. But air pollution affecting pregnant mothers, low birth weight and preterm labor, that has a broad impact that is negative across children growing up. So that in itself can be long-term. But as far as the acute exposure, certainly asthma exacerbation is a big one.
Thanks. So yeah, a couple of questions from David. Maybe I'll kind of lump them together. Is communicating with Republicans outside of the Trump administration or those from non-college backgrounds. What strategies to sort of get folks on board with this message?
So those are great questions, and I have multiple answers. The first answer is what I've already said. Climate change is about our health, and I think there's more common ground when you make the health argument. I think that the health benefits argument, you can make that argument and not even mention climate change. You can say, it's cheaper now to use renewables. Renewables will improve air quality and save millions of lives. So through the health benefits messaging, you don't even have to talk about climate change. I remember in the debate when President Trump was asked about climate change, he dodged the question, but he did say, we want the cleanest air and the cleanest water. Well, just talk about, do you want the cleanest air? How do you get the cleanest air? So you can have a conversation and not mention climate change very easily. when you talk about the health benefits of, clean air, plant forward diets. Although that, the diets I think is trickier because that's really getting to even harder human behavior type things. And here we live in Wisconsin, the dairy state. So I know that's a tough question, but certainly you can lead with clean air and cities that promote physical activity safely, things like that. The other issue, I have two more. One is that there is this false narrative that we need fossil fuels for poor people. The Secretary of Energy is talking about that. And, how can we get rid of coal and oil? And that's the only thing that poor people can afford. Well, as we know that for at least for power generation, that's no longer true. For, household consumption, getting to heat pumps and things like that, it's not, it's not for the poor, it doesn't help the poor by continuing down the fossil fuel road. And then finally, my final strategy that I think may be the most important, and I think I'm going to be doing a lot more of, is to take a look at tobacco and what the tobacco companies did. They knew that cigarette smoking caused lung cancer 60 years before we had rules about tobacco smoke. And they hid the information. They invested in disinformation. And the oil companies that, by the way, have the exact same PR firms and communicators, look up Steve Malloy and junk science. The fossil fuel industry is doing the same thing. In the 1970s, Exxon scientists exactly predicted very, very concise, very accurately what climate change would look like. And so I think it's time to hold the fossil fuel industry accountable for their damages, just like we held tobacco responsible for their damages, and through the Blue Cross Blue Shield settlement with tobacco, that's a lot of money. I think that, when you look at California fires, that's over $35 billion in damages. I think, who should pay for that? There are lawsuits. California is suing big oil. There are lawsuits around the country. I think it's time to hold big oil accountable for their damages and to show them as the villain that they are, just like the tobacco companies.
Thanks. So I've got a comment and then my own question, and it kind of ties into one of the questions that we have. So I think one of the difficulties with, saying that, or convincing people that renewables are cheaper is that, or, heat pumps are cheaper, is often a lot of these technologies have these high upfront costs, but then they have the long-term benefits. And so it might feel more expensive upfront, but if you look sort of over the life cycle of these technologies, they end up being cheaper. And so I think taking a kind of a long-term perspective on that is helpful, just to sort of convince that these technologies can save money in the long term, but we need to find ways of financing them or other ways of reducing that upfront cost. And so on the flip side, you talked about the health benefits. So I'm wondering if you could just give a little bit more explanation on how do you calculate, what is considered premature deaths, and then how does that translate it into dollars?
Right, those are many questions in one. Okay, so the first one is regarding the upfront costs. Of course, I defer to people more expert than me. I'll just say that the Inflation Reduction Act, which still, that's an act of Congress, so there will be wrenches thrown, but that bill still exists. And so to help with the offset the upfront costs, That's a very important advance. And I know that a lot of that money has been committed. So hopefully we'll have follow through with the IRA. And then what was your other questions?
So other questions are, how do you calculate the premature deaths attributed to, fossil fuels? And then how does that translate into, the calculating the economic costs?
Right. Yeah, so these are really looking at observed versus expected. So the epidemiology that goes into this is you say, well, this is what this is the number of people that die every year on these days. And when you compare days that are much more polluted, compare, on that day of the year, in a time when you don't have pollution, what's the difference between the observed number of people who died versus the expected who should die if it wasn't polluted. So it's mostly from looking at observed versus expected, and that's time series analysis. The field of epidemiology is big and complicated, and a lot of methods go into it. But I'll just tell you that there are enormous epidemiologic methods that get you to those numbers. The economics, I would never do this in an international arena. I know in IPCC meetings, you cannot talk about value of a statistical life, especially when you compare an American versus a Bangladeshi person, and you come up with those economic numbers, and they're like absolutely absurd. And that whole concept is absurd in international setting. So, but we simply use the value of a statistical life in America. These are out of the Housing and Urban Development and the EPA, and I think we used a combination of those values. I think we used 10 or 11 million, whatever those agencies. We use a middle of the road number based on what the value of a statistical life is. And I will confess that the biggest number when we talk about Nick Mayhew's work, the $600 billion saved every year, most of it is avoided mortality. Some of it is avoided hospitalization, lost work days, but a big chunk of that financial number is avoided mortality. And I use numbers depending on my audience. So if I'm in a health crowd, the 53,000 lives saved is important. In political arenas, sometimes they really want the dollar sign. So I generally use both of those numbers. But yeah, the biggest contributor is the avoided mortality.
Thanks. And my understanding is, the reason for that is people pay, when they're in the hospital, they pay, a certain amount of money to extend their life. And so then you can do economic calculations to try to determine that value. Is that kind of generally?
Yes, and there are economists that I will not, these are these willingness to pay methods, and I defer to the economists to further explain that, other than you're right. That's the willingness to pay type things.
All right. Well, we got one final question. I think it's a good way to wrap up. So Catherine asks, in Professor Kraft's fascinating textbook, Environmental Policy and Politics, he states that contemporary politics has created a demand for simple ideas. How can we consume climate change news and become educated on environmental issues from thoughtful sources when there are so many sound bites and clips demanding our attention? What sources would you recommend?
So the main thing is I teach the 11th commandment, which is thou shalt know thy source. And to really know thy source, you got to be careful these days. So I would simply say most of us know reputable sources, and outside of reputable sources, I would not get information, and I would absolutely not take something that you don't know where it comes from and send it to other people. So don't disseminate. You know, a lot of people by accident are disseminating disinformation. So go with the reputable sources and understand that there is huge intention of deception in the internet, and to become web savvy and understand that if you don't see a story from multiple sources, or if something looks fishy, it is fishy. You know, just be much more careful and try to use sources that you know are going to be on target. Now, I think that agencies, or information from government agencies could become buried. You know, they might be cut off. So, but wherever there remains reputable sources, go with them, but call out the other ones. You know, when you talk to your aunt or uncle and they tell you something, you know, you ask them, where did that come from? And then go to that source and point out what's wrong with that source.
All right. Well, thank you so much, Jonathan, for your time today and sharing your expertise, and looking forward to seeing more work with your climate forward or health forward climate action centers. So yeah, anxious to see what develops with that, and hope you all join us for our next Sustainable Energy Seminar in 2 weeks. We'll have Professor Mohan Kin from Civil and Environmental Engineering. So hope to see you all there. Thank you.
Thanks for the lively audience and great questions.
Yes, thank you, audience, for your questions as well. We'll see you in 2 weeks.
Thanks.